And it's me again, Chapter 3, and this is going to be very, very quick. So Chapter 3 of Pharmacology, we're going to talk about drug administration again, but we're going to talk about checking it, and we're going to talk about your favorite topic, math. Who does not love math? Math is fun. Math is great. Why? Math is black and white. Math is never anything fluid. It's static. It doesn't change. The formula is the formula, and all you have to do is memorize it. So PowerPoint's going to accompany this. Just follow along, kids. You know what to do. When we talk about checking medications, the manual redundancy system, that's the 5 rights and the 3 checks method, is the safest. So always use that. 5 rights of medication administration plus 1, and then the 3 checks, checking the MAR, the medication order, and the drug label. Make sure that you've got all that information available, and you can never check too many times. When you're reviewing a physician's order, it's always important to note the way the order is written. So, for example, always use a 0 before a decimal point so the dosage isn't incorrectly read. For example, 0.25 milligrams, if you looked at it quickly and didn't see that decimal point, could be misread as 25 milligrams rather than 0.25. And you never use what we call a trailing 0. So 25.0 milligrams, you don't need to write it like that because it could be misread as 250 milligrams. I am not going to go over fractions. I know that you're disappointed, but if you have trouble with fractions, mixed numbers, multiplying, adding or subtracting fractions, you're going to have to get to me, outside of class, and I'll be happy to work with you one-on-one and give you a hand. Same thing with decimals. So for med math calculations, I want to go over this really quickly. You should be familiar with the systems of measurement. The metric system especially. I'm going to try to make this easy as far as household conversions. Remember, 5, 15, 30. 5 milliliters in a teaspoon, 15 milliliters in a tablespoon, 30 milliliters in an ounce, 5, 15, 30. See how easy this is? Okay, when we're talking about drug forms and calculating them, you can have a drug that is a powdered form that needs to be reconstituted. And so that is the solute, and that is a substance that gets dissolved in a solvent, which makes a solution. Woo! And so we're taking something that's a solid and mixing it in some type of a liquid. You have tablets, you have capsules. Remember, desire over half times supply. Desire over half times supply. What did the doctor order? Divided by what do you have on hand times the supply. Okay, it's pretty easy. You don't really, just if you need help, hit me up. When we talk about liquid forms for parenteral dosages, they can be pre-filled in syringes or cartridges. They can be in ampules. Ampules are those little glass things, and you have to use a filtered needle to draw them up. They can be in vials, or parenteral drugs can be dry, and they have to be reconstituted. I'm going to go over IV flow rates, and then we are done. So, intravenous flow rates, they're very important because we need to make sure that a specific amount of fluid gets infused in a very specific amount of time. If the question is asking you how many drops per minute, there's always the same formula. What's the volume to be infused? How much liquid? Times the drop factor divided by the number of minutes, and this is always the one that you use for a gravity infusion. And then the other one would be, if they're asking you how many milliliters per hour, the formula is always the volume divided by the number of hours, and that's the one for infusion pumps. The only other question you might be getting asked about an IV would be, how long will this IV run? Or when will this IV end? If we start this IV of 1,000 milliliters at 83 mils per hour beginning at 6 a.m., all you have to do is take what's the volume divided by the number of mils per hour. Okay? I mean, this could not be any easier. It's like ABC, 1, 2, 3. All right, that's the end of Chapter 3. Peace out, kids. Talk to you soon. Bye.